Welcome to the Dr. Raj podcast. Today's episode features Everyday Rheum, a guest series hosted by Dr. Michelle Koolaee. She is a board-certified rheumatologist with a direct care practice in Pasadena, California. She trained at the University of Pennsylvania and serves as faculty and educator at Huntington Hospital, an affiliate of Cedars-Sinai. Inspired by the conversations she has with her clients every day, this series brings practical insights in rheumatology to patients and the medical community alike. And now, here's today's episode.
Hi, and welcome to Everyday Rheum, a guest series on the Dr. Raj podcast. This podcast is inspired by the real conversations that I have with patients and colleagues every day. Our goal is to bring you knowledge, support, and encouragement to help you manage your rheumatology needs with confidence. Now, today I'm joined by my patient, Rick. Now, Rick is 74 years young. He's a lifelong athlete and someone who knows firsthand that rheumatoid arthritis doesn't always look the way that people expect. And like many patients, his diagnosis was not immediate. It took persistence, advocacy, and asking questions before he got answers. And now that his RA is under good control with treatment, he faces a query that many patients can relate to. How do you tell the difference between an RA flare and the normal aches and pains that come with an active life and getting older? Now, Rick has been an incredible advocate for himself, and I think listeners will find his perspective both practical and encouraging. Now, welcome, Rick. Thank you so much for being with us today.
Well, good morning, Dr. K, and thank you for providing this opportunity to allow us to share. I'm really looking forward to it.
Me too. So let's dive right in. Tell us a little bit about yourself, and especially what is your athletic background?
Well, let me tell you, I'm a former educator. I worked in education for over 35 years, and I recently transitioned out of education. And I like to say I didn't retire; I've been rewired. So I worked in education as a fitness occupation teacher for several years, and then I became an administrator for the district in which I was responsible for developing and implementing career technical education programs. Currently, I work as an interviewer for PIH, the Presbyterian Intercommunity Hospital, in which I actually review applications and interview students who are interested in participating in externships in the hospital setting. I also work with a teen leadership program. I work with an organization called Coach Art. They're an organization that's devoted to providing sports and arts programs for physically challenged youth. I also the chairperson for a scholarship foundation called God Skills, in which we provide career technical education scholarships for seniors pursuing career technical education disciplines at the higher level. And I'm also a skills coach in basketball. Now, I've been a lifetime athlete, Dr. K. Started in junior high, played all the sports, baseball, basketball. Then once I gravitated toward high school, I concentrated on basketball. From there, when I transitioned out of high school, I had an opportunity to play basketball with the Native American Athletic Association. They recruited me for their team, and I also played for the Mexican American League. I was selected to play in the Mexican Pro League, but at that time, I was actually immersed in my educational studies, and I decided not to pursue that. And another thing that was kind of a making in that decision, I'm about 5'5", 132 pounds. The people who I would be facing, they're about 6'5" and 232 pounds. So the immovable forces, I didn't think played in my favor. So I pursued my educational pursuits. So currently, I enjoy, like I said, hiking, jogging, biking, full body workouts. And I'm a skills coach. What I do is I actually train the coaches so they can gravitate and start training the students. And the students can range anywhere from 6 to 18. So that's where I'm at right now. Hopefully that gave you a little perspective.
Yeah, no, thank you for going into that. And you really are amazing, Rick. You're amazing. You're inspiring. Your commitment to your health is really remarkable. And I know we're going to talk more in a moment about your health, but you are so committed and regimented with your exercise. And I think that that is also really inspiring for individuals that are listening that may be navigating having an inflammatory arthritis. Maybe they're newly diagnosed and they're wondering what could life look like having an inflammatory arthritis such as rheumatoid arthritis. Now, looking back when things all started with your symptoms, what were the first signs that something wasn't quite right leading up to your diagnosis?
Well, this goes back to February of last year. What I
Hmm.
initially noticed, doctor, I woke up with some stiffness in my hands and my wrist. And I really didn't think too much of it. I go, okay, Rick, you're getting a little older. That's always the common
Hmm.
excuse I can say or whatever. But I go, this will pass because I do work out quite a lot. I work out 6 days a week and I go, this will pass.
Hmm.
Well, it didn't pass. And it started getting a little bit more stiffer. And like I said, it just didn't feel right.
Hmm.
And that was the first sign that I noticed in my hands.
Yeah, and I think that that's for people that are listening that are it's a common question that comes up. How do I know what is a regular ache and pain and what is not, and what's something more significant? Is in your case and in many other cases, it's the persistence of symptoms.
Right.
So generally, normal aches and pains as we mature, they come and go. But when symptoms are persistent, that is a orange flag to get evaluated because a lot of autoimmune and inflammatory diseases like RA, they are chronic and persistent. And something you also alluded to just now was knowing your body. Like your body's very intelligent, that if there's something that's not right and you're getting that gut feeling that this doesn't seem right, even if you're not sure what could be going on, that's another signal to speak up and to seek evaluation. Now, was there a moment when you realized that this might be more than normal aging or overuse from being active?
Yes. And like I said, after a couple of weeks, it didn't go away. So I go,
Mm-hmm.
and then you notice I started to get a little slight swelling, a little bit of redness and warmth in my. Uh, but the topper is when, like I said, I'm a skills coach. I try to go to the gym and shoot. I was not able to shoot the basketball like like I usually do. I couldn't shoot even from the free throw line. And mind you, I was very proficient of shooting the ball from the 3-point line and further back, and I couldn't even get it from the free throw. And I go, something's really wrong. And in addition to that, I noticed kind of a little fatigue setting in. But again, with during that, you think maybe you're getting the flu or you're getting something else. So I just, but that's when and like I said, when I started to getting a little swelling, and then I couldn't really, I go, something's wrong, something's not right there. So that was kind of like a real strong indicator for me.
Okay, yeah, and I think that again, touching on other signs and symptoms to look for is, and you alluded to this as well, in an inflammatory pain like rheumatoid arthritis, the joint or joints, they can become red and warm and swollen. So persistent swelling in the joints is definitely a clue to get evaluated. Stiffness in the joints in the morning time is very typical for inflammatory pain, especially if it lasts longer than an hour. Sometimes it's several hours. So if you're noticing that more persistently as well, for anyone listening, I think that that's another clue that this is not just a normal ache and pain. Additionally, is people generally seek care when their day-to-day life is interrupted, disrupted by symptoms. So that is also a signal that something's not right. And especially if the pain is waking you up from sleep at nighttime persistently, that's a real concerning symptom that should get evaluated. And lastly, the fatigue. The fatigue that you mentioned, Rick, is something that I hear quite often. And fatigue can and is part of any systemic inflammatory disease. And this is not just the day to day, I just feel tired. Some people, it is really crippling and disabling. And it just feels like it's mental fatigue, brain fog, body fatigue. So again, just all of this combined would be clues of of this not being just run-of-the-mill aches and pains, that you really should get evaluated. So you're having these symptoms occurring. You know that there's something wrong. Walk us through what was your journey in actually getting diagnosed with rheumatoid arthritis?
Well, again, as you mentioned, it was persistent, and like I said, the fatigue factor did play a part. And I'm used to working out, so I alluded to, maybe you're just overworking, but it just didn't seem right. So I went ahead and went to a provider, and the first diagnosis was pseudogout. And I go, okay, and they give me a shot. I guess it's methylprednisolone. They go, it should be knocked out of you. Well, I got the shot, and it just didn't work. And so then I kind of proceeded to contact another specialist, and the analysis was the same. It was like pseudogout, so they prescribed Koolaee. I hope I'm pronouncing that right.
Colchicine? Okay, yes.
And that did seem to help, but very, very minimal. And so after a while, this practitioner, they referred me to another specialist. And this specialist, again, they said it looks like it's pseudogout, but it's not RA. So what they did is they prescribed me a course of methotrexate, and so it did help in a sense where it got the swelling. There was still a little swelling there, but not as big as it was before, and the stiffness alleviated a little bit. But I still couldn't do my normal functions that I used to do in regards to my basketball thing, and just things like opening like a door or something. It was kind of a little achy. So I know you have to give it a little time. So I went ahead and kept up with the methotrexate. But after several months, I noticed something gravitating toward my feet. And I'm going, oh my gosh, is this from my running or something like that? And I started thinking, could this be related to this? So that was like an aha moment for me, because I remember, Dr. K, I previously talked to you, I believe it was right before you were going to open your practice back in March, because I saw you on the website, and I was very intrigued because your practice really supported the holistic approach. And I'm thinking, but at that time, I was in a lot of pain. I wanted to see somebody immediately. And I think that was the last week of March. You weren't going to open till the end of April. So I went ahead and saw somebody else. And so that when that aha moment came, I go, you know what? Maybe I got to give Dr. K a call. So that's when I actually scheduled an appointment with you this January. I went in, and right away you said, you have RA. And you prescribed me some leflunomide along with the methotrexate. And it did help. Like it did alleviate. But I was able to, in fact, go out to the court and start shooting, at least from the free throw line. It was a little sore, but I was never able to do that before. So I go, I think this might be working. So in our visits, you would ask me how I'm going. I go, I'm still doing this, doctor, but I still can't get that. And I was thinking maybe it's because I haven't worked it out. I'm not as strong as. And so we kept on having our conversations, and you had suggested possibly, you shouldn't be feeling like this. Maybe you ought to try biologistics. Is that correct, doctor?
Correct. Biologic, correct.
And you had suggested Humira. And doctor, Mary, I went for a person that never has taken medication in their life to this past year, where I've taken all kinds of several medications. And you were very patient and allowed me to go back home and digest this information. And you said, this is a good thing. I did. So I went ahead and told you, doctor, let's go ahead and try it. So I tried it. And within 2 weeks, I have to say, it was practically like night and day. I was able to go out to that. And I started shooting. I had to put a little effort in it, but at least I was able to do it. And I've been on Humira. I think I'm on my 5th week now. And I noticed, oh my gosh, it's just a difference. I can go out there, and it's am I 100%? No, but I think I'm 93, 94%. And I'm aiming for 100%, doctor. So that's where I'm at right now. So that was a journey. And I had to go through several, and I realized, it's a process. And the doctors try to help you. And I think the challenging thing with that, you're no stranger to this, doctor. Across the nation, even in California, there's a shortage of RA rheumatologists. So, when you find one, you better keep that one. So like I said, the Humira has really made a difference on my week 5 now, and I can just say, oh my gosh, it's different. Even the fatigue factor. You know what I mean?
No, thank you. Thank you for walking everybody through just that journey. And I think it's really helpful in people understanding that. And some things that I will touch on is you can understand the complexity to this, right? That some people do believe, and it's not uncommon, and it's not wrong to think this because people may not know that it's not black and white. It's not that you come in, we get lab tests, here's your lab work, and the labs give us the diagnosis. It is majority of the time, it's not like that. Rheumatology can and is complex. And that is normal. And I think just making sure that you are accurately reporting symptoms, you're feeling seen and you're heard, I think is important, but especially recognizing that it is not a straightforward process. Even a diagnosis as frequent as we see in rheumatology as rheumatoid arthritis, sometimes having changes on the x-ray, the calcium on the x-rays that you had, that perhaps indicated pseudogout, was a red herring. Pseudogout, just to digress, the flares in pseudogout, the symptoms of pseudogout are usually very episodic, and they're not these persistent ongoing symptoms as would be RA. And so it's a lot about like having the space and the time for the rheumatologist that you're seeing to be hearing and understanding what it is that you're experiencing, I think is important. Next is that medication. You touched on being on medication. Nobody really wants to be on medication if it's possible. That is also very important to note. But sometimes being on the right medication for the right indication can really allow you to be at your best health. And in this case, this is a beautiful example of how you were very open-minded, not delighted to be on medication, certainly, but open-minded to these ideas and patient with the process, and recognizing that it is a dynamic process of identifying like what can get us to the best that we can. We always strive to improve. And it's a process of starting with conservative drugs and escalating until ultimately, like in this case, finding a regimen that is really a good fit for you. So thank you again for just illustrating all of these points, which I think are really important.
And doctor, I must add, I haven't really noticed any really severe side effects with the Humira at all. So I said it's like, yeah.
Yeah, and that's great for people to know. So if you are listening and you are, your rheumatologist recommends starting Humira or another biologic, it's normal to feel reluctant. But I think also know that these drugs, biologic drugs, have transformed how we treat RA. And I know we'll touch on this later, but just mentioning that people with RA nowadays generally do have healthy, active, productive lives with the drugs that we have. So now, Rick, that you've been living with RA for a while now, how are you personally distinguishing an RA flare from normal aches and pains?
Okay, and that was a challenge for me in the beginning because you're kind of caught in a quandrum. Is it osteoarthritis or is it RA? And as you get older, it's always okay. You're getting older, but the clue is the clue with me was when the difference is with RA, it was continuous. I had it get a little stiffness and it got a little flare, and it would just kind of stayed on. Whereas with the other normal aches and pains, as you get as you get as you age and get older, you have those because of all your working out. It was almost like it was it was kind of like domes, delayed onset muscle soreness. That was the clicker for me because say if I do a workout and then usually DOMS doesn't come the next day. It comes maybe 2 days after. And once you get that, but then it'll go away. Whereas with the RA, it would kind of linger for, for a week or so, or it would linger. Whereas with the normal aches and pains, it would kind of, fade away within about 3 days. That was the difference. I knew, okay, this is RA related, or it's a little RA flare. That's the difference I noticed. Yeah. I don't know if
Yeah,
that makes sense. Yeah. Yeah.
Yeah, no, all excellent points. And just you touched on, again, important points that I will also elaborate on is really knowing your body. Number one, know your body, know your body. Be very in tune with your body, trust your body. And everyone's disease is different. And so it's about identifying what you notice, and again, certainly persistence of symptoms accompanied by a lot of stiffness, swelling, can definitely be suggestive, and sometimes it's not easy to distinguish, right? Like, is it osteoarthritis? Is it orthopedic? Is it muscular? And that's where I think it's important to just have a good relationship with your rheumatologist and have open communication, and if you don't know, ask, and just recognizing that it's not always easy. And having a plan with your rheumatologist for, what do I do if my pain is mild? What do I do if it's moderate? What do I do if I have a flare? And that is important. And then lastly is just having just having a plan for how to navigate symptoms, and recognizing that it takes a while. It's not like it comes very quickly, figuring these things out. But ultimately, over time, that again, we strive to improve, and we kind of really fine tune care. Now, has being an athlete helped you manage your RA in any way? And have you had to adapt how you approach exercise and recovery now?
Oh, definitely. My athletic background helped me because, especially in the discipline and the consistency. And I mean, you have to be disciplined and consistent, and that transfers over to taking your medication.
Mm,
And what I found out is that it's not about working harder; it's about working out smarter.
mm,
And what I mean is, just for example, I remember we had this conversation. I work out a lot, and sometimes I push myself maybe a little bit over the limit.
mm,
So you had suggested maybe you need to kind of tailor that. And what I did is, okay, instead of working out 6 days in a row, work out three, take a break in the middle, and do the other three. Or another thing is, if you're used to working out a straight hour, do 30 minutes that day. And if you have time in the afternoon, do the other 30 minutes. Or if it's all you can do is 30 minutes, at least do something. But there's ways to adapt, and you can still get a really fulfilling workout. I mean,
mhm. Yeah, that's so practical. And I think it will resonate with a lot of people listening, because some people, again, are maybe before their diagnosis, young or old, they're used to having, if they're active and athletic, they're used to their body allowing them to do a lot more. And it's about meeting your body where it's at, being kind to your body, being flexible, and recognizing that it is a process of identifying, like, what should you do, what can you do, and just being able to know where are your limits. If there's mild discomfort, for example, then perhaps your body will allow you to push through. But if you do a workout and then you're feeling really in a lot of pain the next day, then that should be a clue of, okay, maybe I should scale it back next time. Or, just as you alluded to, giving your body days of rest. And even if your body was allowed you to do 6 days before, that it's okay if maybe now it's 3 days or 4 days. I also emphasize that having consistency is much more valuable long term for an activity regimen, than having it be like either like you're not doing any exercise or you're overdoing it. And then lastly is having strength training, keeping the muscles conditioned with any type of arthritis. is the most important thing you can do. Keeping the muscles conditioned, it protects the joints, it puts less stress on the joints, and is really, really valuable for long-term joint health. And also, as we mature and we age, it becomes increasingly important to optimize mobility, to optimize balance, and to really just help overall, even with normal aches and pains.
And doctor, that's so true about I do full body workouts.
Mhm.
That has allowed me to get back on the horse very quickly because I was
Mhm.
doing those, you know what I mean? Another
Yeah.
thing you alluded to about, you know, about, how old you are, how young you are. I know in our conversation, you know, age is always brought up, but I respect your opinion too, that that's not the total picture because to be quite frank with you, doctor, I know some 70-year-olds that are going on 40 and I know some 40-year-olds that are going on 80-year-olds. It's your
Mhm.
perspective and how you take care of your body. So that's the challenge I had in seeing, healthcare givers right away. What, how old are you? And right away, okay, you're that age. And I mean, you're almost reluctant to give them your age because they're going to, oh, it's because you're getting old. And with you, that was just one part of the puzzle. So
Mhm.
I just wanted to share that with.
Yeah, no, I think that's really, really a nice comment. I saw someone yesterday, just you made me think of that. She was 83, um, but literally she looks like she was 50. I mean, and it's and all of these things that there's another podcast that we talk about longevity and this concept of a super ager. And I do think you are and you will be a super ager. I and it's how you take care of yourself and your attitude and your the persistence and commitment to one's health. So yeah, absolutely. Um, so Rick, you always come to appointments really prepared and engaged. What advice would you give patients about advocating for themselves and partnering with their doctors?
Well, you need to really advocate. So, what I mean, you have to feel comfortable empowering yourself and develop a sense that you ask your health care giver questions. Ask them all kinds of questions. And I would really have concerns if you do have a healthcare giver that frowns upon you asking questions. That would be a red flag immediately for me. And you got to be patient because it is a process, And I think one of the big pieces you need to develop a collaboration with your doctor because it's a two-way street. It's like I always believe, you're not going to go to the doctor. Here's a pill, Rick. You're going to be better by tomorrow. No, that doesn't work. You need to collaborate and have a healthy relationship and realize the more information, the more proactive you are. Like if you take a journal or whatever and provide the doctor information, that helps them pinpoint a lot of things. So you have to be a part of this process. And another thing is that I'm going to use a basketball analogy here. If you get to a point, learn how to pivot. And what I mean by this, if you feel you're with a healthcare giver that isn't meeting your needs, don't be afraid to ask for a second, third, fourth, or fifth opinion. Like me, I'm very methodical in my approach.
Mhm,
And
mhm, mhm.
sometimes that's an asset, and sometimes that could be a detriment because sometimes I dwell in it. But I think again, people they're afraid. Don't be afraid. That's a critical piece. Don't be afraid to pivot and try other options.
Yeah, no, all of those, I completely agree with all of that. And I think sometimes some people don't know how to advocate and it just feels overwhelming. What do I ask? How do I ask? And it can be very easy in my observation for and what I've seen over my career for fatigue and joint pains to just kind of people might dismiss them and just maybe not feel like it's as important to discuss. I sometimes have to tell people, okay, tell me about joint pain, but I want to know about discomfort also, stuff that you're powering through. You might be powering through it, but you need to let me know. And so some of that, as you're mentioning, is just kind of noting, having some way to organize your symptoms so that you're prepared and you can be engaged. And taking journaling symptoms, you don't have to go crazy with it. Whatever strategy works for you and is comfortable and sustainable. I even recommend just on your iPhone on the notes page is just putting down just like notes of what are your symptoms. If a medication's been started, what day was it started, and then kind of being able to know what's my pain, what's my fatigue, and kind of again speaking up and that it's not wrong, and it is important if your needs are not met, if you're not feeling heard, is to continue seeking care. Your health is your best asset, and you are your best advocate. And you have to speak up. I do echo everything that you said. So thank you for sharing that. Now, what have you learned from this experience just overall? And what messages would you like listeners who are trying to find answers or who are newly diagnosed like to have?
Well, first of all, doctor, it's a process. You got to be patient because it does take time. And I'm a very hyper individual. So I had to learn that it is a process. And you got to realize there's many options available out there to help you get you back to your regular self.
Mm-hmm.
And that's where the education piece comes about, because I really believe there's a lot of people in the general population walking around. They don't even realize they have RA. They just think it's because of age, getting older, or old injuries. So I believe you need to educate yourself on this. And I believe the most critical piece in this procedure is to find a doctor that, in addition to having, exemplary expertise in their field, they're approachable. They take time to really, really listen to you. And they provide a variety of options for whatever's ailing you. And you get a sense of feeling that you're not alone during this process. You know, I really believe this because I've had in the course of life, if you're lucky enough, you come across individuals, in this case, doctor, that by knowing them and engaging with them, you become a better person or patient. I've known I become a better patient by knowing and engaging with Dr. K, as I'm sure countless others have. She just has that effect on people. So I believe the doctor, the collaboration, that just plays such a critical piece.
Thank you. These are wise words. I appreciate your kind words, Rick. It really, I'm touched, and it means a lot knowing that that you are feeling fulfilled and in your care, and are feeling healthier in all regards. And I think that having the right information to make informed decisions, and knowing that you do have someone in your corner and not feeling alone, I think are incredibly important for navigating any chronic illness, to be frank. And it can be scary not feeling alone navigating through a chronic condition, and just having the tools and being empowered, I think, is really valuable. So thank you so much, Rick, for sharing your story today. I think overall, one of the themes we hear is that diagnosing rheumatic diseases, it can oftentimes be complex. And it's important knowing what clues to look for to distinguish normal wear and tear pain from inflammatory pain. And it also shows that a diagnosis of RA, it doesn't mean giving up the activities that you love. Many people with RA live with healthy, active, and very productive lives. So to everyone listening, know to trust your instincts, make sure you ask questions, and seek answers when something doesn't feel right. And know that these journeys, while they can be complicated, there is hope, there are effective treatments, and there's people who understand what you're going through. Thank you so much for joining us on Everyday Room. We'll catch you next time.
Thank you for listening to another episode of the Dr. Raj Podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep2Go, and you can learn more at medprep2go.com.